So one of the most common reactions when someone has been asked with type 2 diabetes to start on insulin is just give me a few months and I will get my blood sugars down, or something similar, to try and wait to see if they can do it on their own. And this is called psychological insulin resistance.
Psychological insulin resistance is really an attitude that a person has. Their beliefs about insulin and what bringing insulin into their diabetes regimen would really mean. And you can see from this slide that there are a number of specific attitudes that we hear time and time again. Sometimes people living with type 2 diabetes, when asked to go on insulin, feel that insulin will mean that they're out of control, that they're going to lose control, or it means that their disease is getting worse. Many people lack the confidence to manage diabetes on insulin, or they have a fear of injection or a belief in the anticipated pain. They may see insulin as indicating a failure on their part, or that it will really not benefit. And so in understanding your experience of the shift from managing type 2 diabetes with oral medications to oral medications and or insulin, you might consider the following question. So do you feel that insulin will take control or freedom away from you? Do you think that starting insulin means that you have failed? Are you nervous or anxious about injecting insulin? Do you think that starting insulin will be more work than it's worth, that you will not get anything good from it? Or do you think that starting insulin means your disease is more serious? Do you lack confidence about your ability to manage your diabetes using insulin? If any of these apply to you, then this would be important for you to talk to your healthcare provider about. Psychological insulin resistance is very common, and your provider is interested in addressing your concerns.